You're listening to Battling Opioids, the podcast. Battling Opioids, the podcast, now on Apple Podcasts, Stitcher, Google Podcast, TuneIn, Amazon, YouTube, and now radio.com.
Battling Opioids podcast, Week in Review.
The federal government is renewing a grant to Pennsylvania to address opioid addiction. VIA's Brett Schultes has the story.
$55.9 million. Department of Drug and Alcohol Program Secretary Jen Smith says that's how much the state spent in federal grants this year to help people living with opioid addiction. That's also how much the Commonwealth will get for 2020. Smith says the effort is working.
Making a dent in the opioid crisis requires doing something above and beyond what we've been doing in the drug and alcohol field.
In Blair County, which received $1.3 million this year, Program Administrator Judy Rosser says the money has gone to hiring certified recovery specialists who work in emergency rooms, making sure people who show up because of an addiction end up getting in treatment.
And in the last 2 years, we've been in the 40s with overdoses. And last year, we had 25.
Rosser notes other efforts include hiring case managers and providing people with medication-assisted treatment and the opioid reversal drug Naloxone. In Harrisburg, I'm Brett Schultes.
Presented by Battling Opioids, a project of Pennsylvania Public Media. Pennsylvania will receive another $75 million in federal aid to fight the opioid addiction crisis, money that Governor Tom Wolf's administration says will help with treatment, prevention, and education. Wolf's administration said Friday that about $56 million will go to the Department of Drug and Alcohol programs. The money will also help extend programs designed to help people in addiction treatment find stable housing and to attract treatment professionals by helping repay their education loans. The State Department of Health received $8.4 million, a grant that is expected to repeat each of the next 2 years, while Philadelphia received $5.9 million and Allegheny County received $5.2 million. Wolf's administration says total federal funding for Pennsylvania's opioid response is more than $141 million over the past 2 years. Presented by Battling Opioids, a project of Pennsylvania Public Media. The Wolf administration announced today that on September 18th and 25th, Naloxone will be provided free of charge at 95 locations across the state in an effort to curb the number of opioid overdoses. Naloxone will be distributed at state health centers and county municipal health departments as supplies last. Governor Tom Wolf said of the effort, the life-saving medication Naloxone is essential for every resident to have on hand, particularly if you have a loved one suffering from opioid use disorder. He went on to say that it was important that all Pennsylvanians had the tools needed to combat the opioid crisis. Naloxone reverses an overdose caused by an opioid overdose by blocking the effects of opioids on the brain. Over 25,000 Pennsylvanians have been revived from an opioid overdose by Naloxone since November 2014 by EMS providers and police officers in the state. More information on the initiative, dubbed Stop Overdoses in Pennsylvania Get Help Now Week, can be found at pa.gov/opioids. Presented by Battling Opioids, a project of Pennsylvania Public Media. A drug that can save someone from an opioid overdose will be available in Pennsylvania at no cost during 2 Wednesdays this month. VIA's Brett Schultes reports Naloxone is credited with saving thousands of lives in the Commonwealth.
During a similar program last December, Brittany Webster stood in line for Naloxone at the Carlisle Health Department in Cumberland County. Off opioids for 7 years and working to help others living with addiction, she says she gave 2 doses to a friend whose partner was addicted.
I gave them to her, and both doses were used and did save his life. So he is still with us.
State Health Secretary Dr. Rachel Levine says first responders have used Naloxone 25,000 times since 2014. She says with friends and family members also carrying the drug, it's hard to say how many lives have been saved.
But we know that its availability is so important to save lives.
Naloxone will be available at 95 locations around Pennsylvania September 18th and 25th. In Harrisburg, I'm Brett Schultes.
Presented by Battling Opioids, a project of Pennsylvania Public Media. The Pennsylvania Attorney General is suing some members of the family that founded and controls Purdue Pharma over their role in the opioid crisis after a tentative settlement with 20 other states was announced. Attorney General Josh Shapiro announced the sealed Commonwealth Court lawsuit on Thursday, arguing the defendants should take responsibility for pain they have caused. Shapiro's office also has a lawsuit pending against Purdue Pharma over its marketing practices in the state. Shapiro says the two lawsuits will proceed independently. He says the new lawsuit claims Sackler family members directed, controlled, and participated in a deceptive campaign to sell OxyContin. Messages seeking comment left with a lawyer and a spokesman for Sackler family members weren't returned. Presented by Battling Opioids, a project of Pennsylvania Public Media.
Recovery starts with a call. Call 1-800-662-HELP or visit battlingopioids.org.
It doesn't take long to become addicted to opioids. 13 Pennsylvanians die from them every day. Geisinger is committed to ending opioid addiction with both prevention and treatment. In the last 3 years, we've reduced the amount of opioids we prescribe by 50%, and we've opened 4 medication-assisted treatment centers across the state to help patients recover from addiction. Learn more at geisinger.org/hadenough.